Hello, my name is Caleb Smith and I'm with the Rocket Miner, here with your regular coronavirus update on this Tuesday, March 31st, 2020. I'm still filming by myself, just have a remote, and if you hear a jingle jangle in the background, don't mind the cat. I'm trying not to. We're dealing locally with the fact that Sweetwater County's confirmed coronavirus case numbers have increased to 2. Originally, we had a gentleman from Green River in his 40s who came down with the virus. The case that was most recently reported in Green River is another gentleman in his 20s. Those two cases are related. As the officials continue to do tracking, seeing where people came from, who they had interactions with, those two cases in Green River are now being connected to clusters previously identified in Sweetwater County. As the contact tracing continues, Sweetwater County health officials have now identified more than 50 people throughout the county who are either symptomatic and in quarantine pending official test results, or who are not ill but are proactively and voluntarily self-isolating as a precaution. Wyoming's overall numbers climbed by 25 on Tuesday, as of this recording, to now total 120 cases confirmed. The latest increase in Laramie County now means that it's been the hardest hits, with 27 confirmed cases. As of Tuesday afternoon, the breakdown includes Fremont County with 25 cases, Teton County having 23, Natrona County having 12, Sheridan County having 10, Johnson County with 7, Albany, Campbell, and Carbon County with 3, Sweetwater County with 2, Converse, Goshen, Park, Sublette, and Washakie have all reported 1 case. According to Wyoming State Health Officer, Dr. Alexis Harris, that as of Monday, only 16 people had been hospitalized with the virus, and some of those patients had already been released. One tricky thing that we don't entirely know right now is how long people are contagious. It does seem like even after you recover, it is possible for somebody to spread the virus, so many people who have recovered are in self-isolation. It's also not known what kind of defense that the body, having fought this off, is given. We are still so early with this, and there's not enough data that we don't know whether it's something that once you have it once, you'll never have it again. Whether it's something that gives you a couple years defense, but you may need a booster from time to time. Or the type of thing that as it changes, or just because the defense is only for so long that you might have to worry about getting it year after year. Like the flu shot is something that you can have several years in a row, even getting the shots. You may still have to take precautions and take defenses the next year. We just don't know yet. We're doing our best, and researchers are certainly losing lots of sleep trying to figure these things out. That's one reason why we still are promoting social distancing, doing what we can to stop the spread, stay home as much as possible. Please only leave in the most necessary situations. Looking at the U.S. numbers today, the New York Times is reporting that the number of cases in our nation have grown to 173,741. That includes 3,433 deaths that have been attributed to the coronavirus. Coming from the White House today, our national health experts out of the White House are saying that we need to be preparing for the possibility that there could be 100,000 or more deaths by the time this is over. Looking at Dr. Anthony Fauci, quote, "This is tough. People are suffering. People are dying." Referring to social distancing. this is going to be the answer to our problems. So let's all pull together and make sure, as we look forward to the next 30 days, we do it with all the intensity and force that we can. Now, despite such sobering, frightening numbers, the doctor wanted to leave us with some encouragement too. Saying, as sobering as that number is, we should be prepared for it. It will be difficult. No one is denying the fact that we are going through a really difficult time right now. But he added, when it comes to 100,000 deaths, we don't accept that number. That is what it's going to be. We're doing everything we can to get it even significantly lower than that. This is a wave that's hitting our country at different points and different places. It was pointed out to me today that Wyoming is what was the last state to get to the number 100. We're going to be watching our neighbors and our family members who are spread throughout this country face it. Probably it's going to get more serious where they're at before it gets to the peak here. We have an opportunity to learn from that and to take some extra steps now. Our population and the density of the people who live out here works in our favor, but it's already here. And even if you haven't been practicing all that distancing before, or washing your hands near enough, doing your best to not touch your T-zone on your face, to limit interaction with people outside your household, you can start now. Because we can make the little bit of gift that we have with this time to make as many preparations we can. Best case scenario, it looks like we over-prepared because not much happened. That's what our health officials and our task force people, that's what they're hoping for, is that we took so many steps that we don't have to bear the burden of the horrendous consequences that have happened elsewhere in the world and are now starting to threaten some of our other parts of our nation. Be proactive. Be kind. Be generous with your resources, and be generous by keeping yourself at a distance, even when it's an inconvenience or when it's a strain on the heart. This is what we do for those that we care for. This is what we do for our neighbors. This is how we'll get through this, because we're all in it together. So this has been Caleb Smith with the Rocket Miner Coronavirus Update. Wishing you a good night and a safe tomorrow.